We really think vaccine awareness is super important, and Adult Day is a really good program for really spreading that awareness. If there's anything else you can do to support Adult Day centres to really make people aware of the benefits of vaccines and where they can actually get them, please do it. And this new program is perfect for this. I think NADSA reinvigorates the discussion about Adult Day. More people should know about Adult Day, and NADSA gives people the opportunity to spread that awareness in a national way.
I feel like vaccines are so important to protect our people from just the various diseases. I also work in the hospital, so I see the effects of COVID and the influenza. So we've just got to keep our people safe.
Something that's really important to us in order to keep all of our participants and staff healthy is a continuation of the use of all of our vaccines. And I think that, unfortunately where we are right now is the fact that people are tired. People have, all of our participants, all of our caregivers, all of our staff, we've been, taking through and ebbing and flowing with all these different CDC recommendations and, state recommendations on how we should take care of ourselves. And so I feel like in this period where we're tired, or we're not wanting to hear all this additional information about what we need to do and what preventative measures, but life still goes on and we haven't actually gotten away from that. And despite the fact that, I feel like in a post-COVID world, we are still post-COVID. It's a whole different, baseline of everything. And one of the biggest things is now that we're really seeing is that COVID is still out there, that vaccines are still incredibly important. And being able to get those boosters, per your doctor's recommendation, as well as also we saw a huge bout, especially last fall, with RSV in our populations. So whether or not it's the intellectual and developmental disability community, whether or not it's an aging community, behavioral health community, our vulnerable populations still need this layer of protection. And on the flip side, our staff, our whole environmental facilities and our staff, we want them to be able to rise to the challenge to come to work. We don't want them to have absences. We want them to feel protected and safe from our organizational provider lens as well. And I think that the way that we can continue to do this is still to continue to promote the importance of preventative medicine, which is have vaccines. And I know that there's apprehension out there and people don't want to make that doctor's appointment, but this is the wonderful opportunity of risk less, do more, in order to be able to provide additional opportunities to have least amount of barriers to being able to access all these vaccinations. Everything's so rapidly changing so quickly. And I think that from us in the Adult Day services space is kind of our responsibility to making sure that we have a healthy community. And I think the level of transparency that we have with everybody communicating, being able to have programs that support all of these ventures, that it's not just coming from us. This is a best practice for us in a larger sense to be able to make sure that we're looking comprehensive and holistically at everybody and making sure that there's a level of protection and that they're able to, again, continue to engage in all of our Adult Day services.
That's to get the word out.
the word out, and also being able to share that we know that things change every 6 months.
Right.
We know that unfortunately, our technology and our advancements in the medical world are all turning, and we know that it's really hard to guide a nation in one particular direction. And so understanding that level of transparency and communication always and continuing with the staff, with the participants and their caregivers will help that narrative, I think, go along with a greater acceptance around getting these preventative vaccines.